push all these buttons. So how are you guys doing? And welcome.
Doing good.
Good.
And thank you for both being here. Thank you for both being here. We definitely appreciate it. You guys are doing quite a bit. Now, tell me this healthy aging program. Tell me a little bit about that. Which one of you want to start that off?
Yeah, Kristy, why don't you go ahead and start?
Yeah, that would be great. So I work for the Utah Department of Health. Until October of 2020, we had an Alzheimer's disease and related dementias program, and then an arthritis program. And in October of 2020, those came together and created the Healthy Aging program. The goal behind this was to add other services eventually, such as falls prevention, nutrition, and several others. That's all kind of in the works. It started with the legislative session, and now that the Department of Human Services and Department of Health are merging, that is the main focus. And once that settles down, then we'll focus on getting other programs within healthy aging.
So, Ronnie, how does all of this tie into what the Alzheimer's Association is plotting and doing and delivering?
Yeah, so we were actually the instigators and the primary driving force of getting the Utah State Plan for Alzheimer's and related dementia started back in 2012. And then we've been working very diligently over the last several years with our advocacy and public policy work to get the state plan adopted by the Utah State Legislature. In 2014, we actually were able to get the legislature to assign the state plan to the Utah Department of Health as the primary department in the state responsible for the implementation of the plan. And then we worked in conjunction with them to help create a coordinating council where we have over 100 different partners that have come together who all have a role in working with aging adults, many of whom have engagement with those adults who have Alzheimer's or related dementia. So we brought this group together, and they're working with us to help focus on the primary goals of the state plan, which include a dementia-aware Utah, so really helping to raise awareness about the disease. We want to help support and empower family and other informal caregivers. And then we certainly also want to help make sure we have a competent dementia workforce, whether that's in the primary care setting or in an emergency room setting or even in a long-term care setting, making sure that all the staff that are working with someone with dementia have the training that they need and understanding of the disease so they can best help their patients. And then finally, the fourth goal is to focus on expanding research throughout the state. We know here in the state of Utah, we have an incredible amount of research through the Huntsman Cancer Center, and that center gets millions, if not billions of dollars in grant money from the state government or for the federal government to help promote Alzheimer's or cancer research. We want to create that same kind of a situation here in the state of Utah for Alzheimer's and dementia research. And so we are working with the legislature as well as all of our partners to help move those initiatives forward. And so as part of that, we were able to help, our legislative work was able to help secure funding to move some of these initiatives forward. We, about 3 years ago, were able to get $1 million funding, part of which went to the Division of Aging, and the other part went to the Department of Health and Kristy's team to help move some of these initiatives forward. And so we've been seeing some good success from that. And we just hope that we can continue to move those things forward. That's something that we'll always do as the Alzheimer's Association, is advocate on behalf of people who are living with dementia and really want to make sure that they have the very best care and support that they can in the state.
Kristy, go ahead, Kristy. You want to add to that? I have a question for you too, but go ahead.
Okay. I was going to say that we got really lucky in being able to work with the Alzheimer's Association. I think that the funding for Alzheimer's disease and related dementias is so small in Utah that it's important that we have our state plan, which Ronnie mentioned, and we also have a coordinating council that has about 130 to 40 members statewide. And I think that's really important to bring us all together and to showcase what we're individually working on and ensuring that we're not duplicating efforts and that we're working together. And I think that's a huge part of what my role is at the state, is to bring that council together to make sure that we're working on the 4 goals that Ronnie mentioned. And then We also do a lot of speaking engagements like this, and it's fabulous. I really love what we do at the Department of Health, and we couldn't do it without the Alzheimer's Association.
We find ourselves in a dilemma with this COVID and this pandemic reshaping how we communicate. How has that impacted what each of you do out in the marketplace? And you use the word duplicated. I love that word because sometimes we need to duplicate the message so that people get it again, to reiterate it in their minds that there is a place to go. There are things you can do, and there are methodologies that you can instill within your family that helps you deal with the possibility and or the actuality of someone in your family with Alzheimer's or some dementia related issue. How has COVID impacted what you do, Kristy, to the point, has it made it even easier for you now? Because people are listening to everything that's happening. Has that made it easier for you, or has it complicated the process?
It's complicated the process a little bit with COVID. We kind of slowed down our dementia messaging in efforts to help with that COVID information. And we also used to find ourselves in community centers and long-term care facilities before, where now that's not an option due to COVID. So we're excited for that to kind of keep moving on, and hopefully things will get back to normal soon.
Good.
And I think for us, James,
Yeah.
you know, we've never stopped moving forward and providing care and support for people with dementia, despite COVID. We've had to change the way we do it, though, because people with dementia are some of the most vulnerable people who are susceptible to disease because of their age. So we made a decision back in March when COVID first became a big thing as an organization nationally, that we would all work remotely. So we moved our education programs that we offer, our support groups that we offer, all to a virtual format. And that was certainly a little bit challenging, because we also know that some of the people who need those services may not be the most people that may not be their most favorite method of engaging is virtually and online. But we've been able to see some great growth in the number of people we've reached through our support groups. We've been able to provide online education programs, and we've been able to do more face-to-face, Zoom calls to do, one-on-one consultations with families and get them the resources they need. So while we saw an initial dip in our service in March and April of last year, each month since then, we've seen a continual growth of the number of people we've been able to serve. One of the other great resources that the Alzheimer's Association provides always, even before COVID, was our 24/7 helpline that people could call anytime, day or night, get help in over 200 languages and dialects, and get the support they needed by talking to a master's level clinician there at our helpline call. And so that number of people can call even today is 800-272-3900. And whether they just have a simple question about dementia or they're dealing with a crisis right now, that call center can really provide the help and support they need right now.
Yeah, and it's been interesting. So we offer 3 particular educational opportunities in Utah, and none of them are operated or owned by the state of Utah. And so it took about a year for those to go online. So those just barely started being virtual in January and February. And there was such a high demand during the pandemic, we just didn't have them to offer. So we're really excited that we have those. And then we also, we run an Age Well campaign. It's agewell.health.utah.gov. And that's part of our Dementia Aware Utah goal. And on there, we utilize a lot of the Alzheimer's Association's resources, especially that 24/7 hotline. I recommend that to everyone that I talk to.
And what's that number again?
It's 800-272-3900.
I would think, on the downside, COVID has made a lot of changes to how we impact the communities that we serve. But on the side, as things clear up and we tend to get back to what was normal as a normal process, I think we're going to still utilize some of the methodologies that we've developed and created through COVID, because it's going to make us twice as impactful and effective in getting our message out, but more importantly, delivering the services that we have to deal with these issues. Now, as a first timer coming into the room to to think about this, it's a lot of things to think about. There are a host of organizations associated with you guys. How do you sort it out? How do we sort it out? And what can we do to help facilitate passing the knowledge on?
Yeah, so I'll just share from the Alzheimer's Association perspective. We have a great referral service. And so we know there are things that we do and we do great. We do very well in. And so that education, that consultation, our support groups, our helpline are awesome. But we also know we can't do some things. One of the things we don't provide, for instance, is respite support and care. And so in that case, we would refer them to some of our great partners like the area agencies on aging, who have some specific funding to help with respite care, so that a caregiver can bring someone in to sit with their loved one with dementia, so they can go off and go to a movie or even just take a nap, because caregiving is such an onerous responsibility. And as this disease progresses, it gets worse and worse and more of a burden. And maybe burden's not the right word. People don't consider their loved ones burden necessarily, but the stress and the impact that the caregiving makes, as this disease progresses, they have issues with communications, issues with strange behaviors that they've never seen their loved one do before. And so that just becomes more of a challenge for them. And so we certainly recommend anyone who's caring for someone with dementia to reach out and get the support, whether it's from the Alzheimer's Association or the Department of Health or the area agencies on aging. There's a lot of great resources that are available for folks to help them make this role of caregiving that much easier for them. And to your point, James, about the things we've learned from COVID, we didn't really offer a lot of virtual resources before COVID. We tried to do as much as we could in person. We really felt like that was the best way to engage people. But we found that by offering our support groups virtually, we've tapped into a whole different group of people who, for whatever reason, wouldn't be able to go to a support group in person. And so we will always now offer a virtual option for those individuals who, for whatever reason, can't leave their loved ones and travel to a support group, particularly in rural communities here in the state of Utah. We found that that's a really effective way for them to engage and get the support that they need.
I know there's a lot of conversation about seniors not understanding the depth of technology and what to do and how to communicate. And many of us have tried to use the technology as a way to say hello, goodbye, how are you doing? But now here's a way to use technology in a way that is going to create and make people aware of the wellness process and being healthy and being alert to that healthiness. But most importantly, they've now been able to tap into the organizations like both of yours to really get a feel and understanding of what's happening, because no matter what, the technology is changing, but the research is changing to the betterment of the services that are being offered out there. And so this is the way to stay right in the loop, join the membership, look at what's going on, get a firsthand understanding of what these organizations are doing, which is going to make it easier for individuals to understand what they need to do if they understand what you guys are doing and figuring it out. I'm really so proud to know both of you and to have a chance to share my little tidbits and get the message out. Well, as you know, we've been building this platform for a long, and it's a tough thing to do. But what I have learned, that there are great people like yourselves who are doing absolutely honorable work out there. And I think if our community understood that more, they would be more safe. They would feel more safe. They would be more comfortable with the fact that it takes all of us to build the village to take care of our children, and our children are all of the people.
Absolutely. I think, James, one of the things that we've seen throughout COVID is, we have an awesome website as well at alz.org that people can go to, get a lot of great resources. And we've seen the traffic on our website has just increased significantly over COVID, because more people are going to our website and getting that resource. And we also have our social media accounts, Facebook and others that we've tracked. And one of the neat things about Facebook is it allows us to track some additional demographics. And we've seen the average age of the people who are reaching out to our Facebook and our social media increase. We used to be, our sweet spot, so to speak, was people age 40 to 65. And for the most part, those were caregivers reaching out for support.
Right.
But we've seen that incrementally increase over the last several months. So now we're getting a lot more people in the 70s and 80s who are, making use of our resources. So we know that more and more people who might be considered in that technologically challenged area that are learning, they're reaching out and they're getting that information they need, because COVID's made it necessary that that's how they get their information now.
We're now stuck with the fact that we don't have a lot of time to do other things. We can sit and focus is what it's all about. Kristy, you've got a lot on your plate. I mean, this aging thing is a big deal. Why don't you tell us about many of the prongs to this fork that you have, so we can understand what all goes on with the various programs that you represent?
Yeah, so I represent the Healthy Aging program primarily. I focus on Alzheimer's disease and related dementias. So we have courses called Dealing with Dementia, Dementia Friendly Utah, Dementia Dialogues, and all of those are courses that we offer statewide. We have trainers at just about every area agency on aging. And like Ronnie mentioned before, we refer a lot to the Alzheimer's Association and to the area agencies on aging. On our website, there's two of them associated with me. There's one that's livingwell.utah.gov, and you can search for the classes on there and actually register for them. And then there's also our agewell.health.utah.gov, and that actually links to the Alzheimer's Association and to some of our partners. There's a copy of our state plan if anyone was ever interested in reading that. And mainly I focus on bringing people together. We are also working on education systems for those caregivers in long-term care facilities who may not have any education in specifically Alzheimer's disease or related dementias. And I think a big win for both Ronnie and myself was amending that rule and requiring some dementia education to those caregivers providing the hands-on care in the long-term care facilities. So those are my main roles, but I also work with the Department of Human Services and Department of, my brain just totally went blank. We have a bunch of programs within the Department of Health. And so we're adding falls prevention in, even though they're not technically under healthy aging yet. So we're looking at that and how we can work together. Funding is so limited for some of our aging causes that we're working on braiding that funding, which means I bring funding from one source and someone brings it from another, and we figure out how we can work together on a project so that it best serves our Utah residents and it best serves the purposes that we're trying to achieve.
What do the statistics look like? Are we finding that this realm of coexisting collaboration, if you will, is helping the statistical issues, either from an awareness standpoint or from a minimizing the problem or the outcomes from having the problem?
Yeah. So with our Age Well campaign that I've mentioned, we are tracking the numbers of annual wellness visits, which is a visit provided by Medicare for free. And we encourage anyone that's 65 or older, or anyone that has concerns with their memory, thinking, or behaviors, to go and ask for what we're referring to as the brain health check. Right. And these annual wellness visits have actually almost tripled in the past several years since we've started our campaign. I'm not saying that that's because of our campaign, because we don't know for sure.
I'll say it,
but
it's because of the great work they're doing.
But even if a small amount of that is because of our campaign, it's a win in our books. An annual wellness visit has so many parts to it, and a brain health check is just one portion. And I'm sure Ronnie knows these statistics better than me, only about half of the people with dementia are actually diagnosed. And that's a concern. Another concern is, well, if I'm diagnosed, well, what can I do about it? And the answer to that is you can treat the symptoms. You can still live a happy life. It's not the end all. While there may not be a cure for dementia, there's definitely hope. And there's things that you can do so that you're finishing out your life in a happy, healthy way.
Yeah, there's over 34,000 people in the state of Utah that are living with Alzheimer's or dementia. As Kristy said, fewer than half of them have ever been diagnosed. And, from our numbers, only about 5% of those people living with dementia are ever connected to additional resources that could really help them and their caregivers. And so while we're getting more and more people that are, to Kristy's point, that are going to see their doctor and going through those steps, we're still not seeing the growth that we need in people getting the resources that they could have. Alzheimer's is the 4th leading cause of death in the state of Utah right now. And at age 65, 1 in 10 people have the disease. At age 85, 1 in 3 people have the disease. And so this is a growing issue. Here in the state of Utah, we've always been identified as a relatively young state. We have a lot of young families and things like that.
Right.
But for the first time in 2020, there's the fastest growing population segment in our state is no longer the 0 to 18-year-olds. The fastest growing population segment is 65 to 85. And the folks at the University of Utah, the Kim Gardner Institute, that look at all those demographics tell us that trend's going to continue for the next 40 years. So we're going to see an ever-growing number of people who are in that age range where they're most susceptible and most likely to have this disease. And so we really need to not only step up our efforts, as Kristy talked about, of getting people diagnosed, but getting people diagnosed earlier, because there is a lot of research today that says when people are in that stage of life, what we kind of refer to as mild cognitive impairment. Right. So that's when they start to first realize they might have a memory issue, but it hasn't progressed far enough yet to actually be dementia or Alzheimer's disease, that there's a lot of things that people can do to reduce their risk of that even getting any worse. And the research shows that doing things like eating a healthy diet, exercising regularly, getting enough sleep, stimulating your mind cognitively, learning new things, getting social engagement, all of those things can really reduce their risk. And so, but if people wait until they're seeing the middle to late stages of the disease, those things really won't help them a lot. So we need really, people to, as soon as they hit age 65, we want people every year when they go to have their annual wellness checkup to ask their doctor for a cognitive assessment. And by building that baseline, people can really start to see when they might be having issues. And then they can start doing those preventative types of things that can reduce their risk for this disease. One exciting bit of research that we've just learned about is that right now the FDA is considering the approval of the very first drug that will treat the underlying cause of Alzheimer's disease. Wow. We know that part of this is a buildup of amyloid plaque, a protein in the brain that begins to destroy brain cells, primarily in the memory centers to begin with, and then it travels throughout the brain. But this new drug is one that could actually start to deplete the number of amyloid protein cells in the brain. So it won't reverse the disease. It won't, build back any brain cells that have been killed, but it could literally stop the further progression of the disease. And so there again, if someone knows 20 years before they start seeing, really a lot of symptoms that they're starting to see an amyloid protein buildup in the brain, this drug could be used to help them not see any symptoms of this disease in their lifetime. So we're really hoping that the FDA will approve that here in June is when it's scheduled to be released.
We'll applaud that when that happens. So the issue is, and I had an experience when I went to the hospital for my prostate cancer, and I learned that all men, 80% of all men will get prostate cancer, and I'm going, I didn't know that, perhaps if I had known that, I would have done or taken some other kinds of steps. Prevention is a broad term in this process of dementia and Alzheimer's. Is there a difference in the percentage of women or men who get dementia or Alzheimer's?
Unfortunately, 2 out of every 3 people with the disease are women. And women are twice as likely as men to get Alzheimer's disease. We're not quite sure why that is. Research hasn't shown that definitively yet, but that's the reality right now, is that women are more impacted by the disease. And unfortunately, on the caregiver side, almost 2/3 of all of the people who are caring for someone with dementia today are women. And so, in fact, if you look at the the number a little more deeply, those caregivers who are giving 40 hours or more per week in caregiving service, 75% of them are women. And so women certainly are carrying the brunt of this disease because they're more susceptible to get it themselves, and they're more likely to be a caregiver. And so for those of you who have wonderful women in your life, definitely we want to make sure you get them screened, have a cognitive screening with them. And if they are caring for someone, surround them with as much love and support and help as you can, because what we find is that because of the strain and the stress of caregiving, that a lot of times those caregivers' health actually goes down faster than the person they're caring for. And anywhere from 30 to 40% of all caregivers end up dying before the person they're caring for, because they're not taking care of themselves. And so we really want to make sure that we help support anyone who's providing care for someone with Alzheimer's and dementia. It's a very stressful and straining job.
So we've got a lot of issues. One, we've got to improve the condition of our caregivers and what they get. We need to take care of them. Housing is becoming an issue. Building communities that are sustainable and that those people who may be facing Alzheimer's or dementia can be in an environment that they can get everything they need, because the less travel, the less movement in terms of going out of their environment is better for them having a better life. So there's a lot of things that we have to look at. Wow, you guys continue to blow my mind with great stuff. The one thing about talking to you guys, it's not an unhappy conversation. It is so enlightening to know that you're doing, we can do, and we're building the right kind of platform to make a difference. And I'm just awesomely honored to have a chance to put the, as we close, and I'm talking to the great Kristy, Russel, and the great Daniel over at Alzheimer's. Before we go, is there something in conclusion you'd like to say? And I'd let you go first, Kristy.
Yeah, I think that a lot of people who might be listening may not see themselves as a caregiver. And I just want everyone to sit back and think about tasks that they're helping loved ones, whether that's a family member, a neighbor, a community member with. You may not see yourself as a caregiver, but if you're doing regular services, even if it's grocery shopping once or twice a week for somebody, you are a caregiver. And right now we have a lot of our caregivers who are sandwich generations, who are caring for their own children and they're caring for their parents. And a majority of us in this field have been caregivers ourselves of somebody with dementia. And so we understand where you're at and how you're feeling. And I never want anyone to hesitate to reach out to me. I don't care how you find me, if it's on the Department of Health website or our Age Well website, reach out because we're happy to help. The Alzheimer's Association helped me a lot through my original caregiving. And so I would highly just get help and take care of yourself. And you don't see that you're a caregiver, but I promise any services that you're doing regularly, you're a caregiver. And I just want people to help remember that, because it's going to keep them healthier by taking care of themselves. And you sometimes don't even realize how busy and how much you're neglecting yourself. And so it's important to me for that.
Ronnie?
Great. James, first of all, thanks for bringing us on today. I really appreciate you helping us spread the word. And I just want to close with the word of hope. You know, I am so hopeful and so feeling so excited about the research that's happening out there. I believe that in my lifetime, we'll find our first survivor of Alzheimer's disease. I believe that with every fiber of my body. And I know that that's going to happen. And so that doesn't necessarily bring hope to people who are in the midst of this struggle right now. I know that, but as Kristy said, reach out, get the support you need. We're here, we're ready and willing to offer engaging help and support. We care about you, we love you all, and we want to make sure we get the support you need. And so James, thanks for all that you do and helping us spread the word, and we appreciate all the work that you do.
Thank you, Ronnie. Daniels, wonderful man, Kristy Russel, wonderful lady, and all you guys out there, find you a wonderful woman because she can be a great caregiver. That's an excuse to go out and go hunting, fellas. You know what I mean? And Ronnie said it, not me. Oh, thank you very much, guys. You have a wonderful day. Continue your great work, and God bless you. Thank you.
Thank you so much, James. Have a good day, guys.
Bye-bye.
Have a good one. And that's Living and Aging with Pride. And I'm telling you, we got the answer. All you have to do is listen to these great minds.